Assalamualaikum warahmatullahi wabarakatuh to Miss Aisha and my friend. So today, me and my group will make a presentation on the topic water-soluble vitamin. Okay, now I will explain the first subtopic in this topic, which is category of water-soluble vitamin. So basically, water-soluble vitamin is divided into two groups, which is B complex and non-B complex. So we go first to the non-B complex. Non-B complex vitamin only have one vitamin, which is vitamin C, and also known as ascorbic acid. So for the B complex vitamin, it includes 8 vitamins, which are thiamine, vitamin B1, riboflavin, vitamin B2, niacin, vitamin B3, pantothenic acid, vitamin B5, pyridoxine, vitamin B6, biotin, vitamin B7, folate, vitamin B9, and also the last one, cobalamin, vitamin B12. So that's all from me. I will pass the presentation to the next presenter. Thank you.
So my name is Mark. Today, let's talk background and definition of vitamin. So for the first vitamin, thiamine is discovered in 7, isolated in 6, and the first time in 1996. State that cell is head organization of thiamine is accessible to counter acid. Thiamine, sometimes called thiamine, this is a vitamin that can be found and it's also available as a dietary supplement. It also can be found whole grains, beans, and some meats. Also, seafood. Next is eat baby. First, synthesized right after being and isolated in a water soluble yellow crystalline powder. Sorry, it is nice. It's a culinary being vitamin. It has a design. Flavin, the type, flavin, and the name denote the type. It also can be found in drink, yogurt, liver, kidney, soup, cheese. Next is niacin. Niacin is a water-soluble form of a vitamin B3. Conrad Belgium scientist discovered 1987. First, vitamin B3. The deficient condition cause skin rashes, diarrhea, and even you. It acts as a coenzyme in a metabolic. Next is a pantothenic acid. Pantothenic acid is an essential nutrient found naturally in some foods and added to the acidic substance. The formation of the CoA barrier is the principal activity of this water-soluble. We also known as vitamin. That's what is a C. Albert Zen identified a chemical called hyaluronic acid from adrenaline in 1928. Charles Graham discovered vitamin C in his laboratory 4 years later. Concrete is hyaluronic acid. Norman discovered structure. It comes into interchangeable biologically. One is form exorbic acid and oxidase form hydroxorbic acid. So from this slide, point.
Assalamualaikum warahmatullahi wabarakatuh. My name is Farhan Dofil Hadi from Group 1 and from SR113 through F. Today I'm going to present about water-soluble vitamin source. There are two types of vitamin that is water-soluble, which is vitamin B and vitamin C. In vitamin B, there are many types of vitamin such as thiamine, riboflavin, niacin, pantothenic acid, and others. Today, I will explain about only the source of vitamin and vitamin C because of the limited time. Thiamine is also called as vitamin B1. It can be found in unrefined cereals, beans, and liver. A deficiency of it can cause beriberi. Besides that, there are also riboflavin. It is also called as vitamin B2. It can be found in milk, milk drink, yogurt, liver, and mushroom. Other than that, there are also vitamin B3, which is niacin. It can be found in meat, poultry, fish, grain product, peanuts, liver, and seafood. Lastly, of vitamin B is pantothenic acid, which is also called as vitamin B5. It can be found in oats, tomato product, kidney, yeast, egg yolk, and broccoli. Next, the source of vitamin C can be found in mostly citrus fruit, potatoes, kiwi fruit, cabbage, green pepper, and spinach. However, according to Australian government's Rural Industry Research and Development Corporation, the kakadu plum has the highest recorded level of natural vitamin C content of any plant in the world. It is more than 100 times of vitamin C in orange. Kakadu plum is from Australia and it is not our local fruit, so it is hard to find kakadu plum in store. So that is all from me, and I will pass it to the next presenter. Thank you.
Assalamualaikum and good morning to Miss Aisha and my fellow friends. My name is Muhammad Zaid Hazim bin Azhar and I will continue the presentation about deficiency of water-soluble vitamins. First of all, we'll start with vitamin B deficiency. Firstly is thiamine, which is vitamin B1. It related to heavy alcohol consumption combined with limited food consumption. Furthermore, beriberi, which is muscle weakness, and Wernicke-Korsakoff syndrome was a mental confusion. Next is vitamin B2, which is riboflavin. The high risk of this vitamin is alcoholic, cancer, heart disease, and also diabetes population. Other than that, it can give riboflavinosis, which is a sore throat and inflammation of the tongue. It also lead to vitamin B6 deficiency. We move to niacin, which is vitamin B3. The deficiency for this vitamin is pellagra, or known as rat sickness. The primary symptoms is dementia, which is a decline in cognitive function, diarrhea, and also dermatitis. Next is vitamin B5, which is pantothenic acid. The risk group of fat diet, which is a lack of nutrient. It gives several symptoms such as irritability, restlessness, cramps, numbness, vomiting, and also sleep disturbance. Other vitamin is vitamin B6, which is pyridoxine. The deficiency is microcytic hypochromic anemia, seborrheic dermatitis, and also neurologic system, which is depression, confusion, and also convulsion. So we continue with biotin, which is vitamin B7. The high risk group is eating raw egg white over a long period and long-term anticonvulsion drug user. The symptoms is initial hair loss, rash, convulsion, and other neurologic disorder. It also delay our growth. We move to vitamin B9, which is folate. It may stem for several consumption, such as inadequate folate consumption, inadequate folate absorption, increased folate requirements, impaired folate utilization, and also altered folate metabolism. Lastly is cobalamin, which is vitamin B12. This vitamin gives pernicious anemia that cause of formation of megaloblasts and microcytes, and also it causes meningitis to swell and break down, which is leading to brain abnormalities and also spinal cord degeneration.
Hi and Assalamualaikum. My name is Muhammad Fazrah bin Masabri. So today I will be present about access, toxicity and side effect of vitamin. So firstly is thiamine. Thiamine is referred to Thio. Thio is sulfur and amine is nitrogen. So when the amount of vitamin B1 that also as thiamine exceed to the normal level in the blood, it can cause hypertension or high blood pressure. So the side effect of the thiamine is our skin will warm, severe allergic reaction that we call it as an anaphylaxis, skin discoloration and sweating. So for the toxicity, to date there are no report of thiamine and no upper limit has been set. And then riboflavin. Riboflavin is also called as the vitamin B2, and a name of flavin is a yellow. When taken by mouth, riboflavin is likely safe for most people in dose up to 400 milligram daily. In some people, riboflavin can cause the urine to turn bright yellow color. It may also cause nausea. When someone take high dose of vitamin B2, so it's referred to can cause hypertension and low blood pressure. So for this, toxicity is no case reported and no upper limit has been set. And then is pathogenic acid. So when someone have more pathogenic acid, it can lead to diarrhea, heartburn, nausea, dehydration, edema, joint pain, and clarification in blood vessel or depression. So what is the side effect of the pathogenic acid? So our muscle will pain, joint pain, diabetes mellitus, and sore throat. So for the toxicity, high intake has not caused an adverse effect and no UL has been established. Folate is vitamin B9. It can cause nausea, loss appetite, stomach pain, bitter and unpleasant taste in our mouth. So for toxicity, it prevents the formation of erythroid RBC that signal the lack of B12. From an exacerbate the neurological problem associated with vitamin B12 deficiency. Number 3 is HIVs and respiratory distress. So for upper limit, the doctor recommended just 1000 microgram per day. So for vitamin 12, vitamin 12 is not effect for our body. So for toxicity is no upper limit has been established and no not been shown the cause harmful side effect of healthy people. Lastly is vitamin C. Vitamin C have two active form. First is reduced form, that is ascorbic acid, and second is acidized form, that is dehydroascorbic acid. First is side effect of vitamin C is too much vitamin C may cause digestive symptom because the most common digestive symptom of excessive vitamin C intake are diarrhea and nausea. Second is vitamin C can lead to the iron overload because vitamin C bind with the plant food, making it easier for our body to absorb this important function, especially for individuals who get most of their plant food. And then number 3 is taking supplement in high dose may lead to the kidney stone. So excess vitamin C is excreted from the body as oxalate. So our body have waste product. So it consuming too much vitamin C has the potential to increase the amount of oxalate in our urine. Thus, it can increase risk of developing kidney stone. So for the toxicity, first is taking more than 2000 mg daily for prolonged. That used for lead to the nausea and abdominal cramp, and the doctor recommended upper limit is just 2000 mg per day.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Amir Faiz, and now I will present about my part, which is recommended nutrient or vitamin intake for Malaysia. Alright, first is vitamin B is thiamine. The function of thiamine is energy yield reaction. Thiamine is the weak portion of the coenzyme, and thiamine phosphate TPP participate in decarboxylation, which is remove carboxyl group. And second, nerve function is TPP helps synthesize and regulate neurotransmitters. For dietary recommendation, RDM men about 19 years old is 1.2 milligram, and for women just 1.1 milligram per day. For pregnancy women, just 1.4 milligram, and lactation 1.5 milligram per day. Pantothenic acid. Pantothenic acid is also known as vitamin B5, and the function is component of coenzyme, and the dietary recommendation is 5 mg for adult 19 to 15 years old. The last one is the fourth is vitamin B6, and the function for vitamin B6 is PLP support reaction that include the transfer of amino groups, carboxyl group of water, support protein metabolism, blood cell synthesis, carbohydrate metabolism, and neurotransmitter synthesis. And the last one is vitamin C. Vitamin C function is as antioxidant in our body, such as collagen synthesis, collagen formation that helps reinforce the connective tissue that hold together the structure of the body. Next is antioxidant activity for minimize free radical damage and reduce the risk of HD, cancer, and cataracts. The last one is iron absorption. Iron absorption is enhance the absorption of the non-heme iron, which is plant food. That's all from me. Thank you.